coronavirus cases in India have crossed the 1 lakh mark, a harrowing milestone despite being the world's largest lockdown. Our Honorable Prime Minister Mr. Narendra Modi addressed the nation at 8 p.m. on the 12th of May 2020, stating that Lockdown 4.0 would be one with more relaxations. After tapering last month, India's coronavirus trajectory has picked up this month, with new infections and deaths rising faster in India than in most other countries. To get the full picture, let's trace back just a little bit to track the growth in our country from the time the lockdown was initially introduced. India recorded its first case of coronavirus on the 30th of January 2020 in the state of Kerala when a university student from Wuhan traveled back to the state. It took almost a month and a half for the cases to rise to 500 when the lockdown was first initiated. The Janta curfew was a 14-hour curfew imposed by our Prime Minister on the 22nd of March 2020, following which, while addressing the nation for the second time on the 24th of March, he announced a 21-day-long nationwide lockdown. He said that the only solution to control the spread of the virus was to break the cycle of transmission through social distancing, and added that the lockdown enforcement would be relatively stricter as compared to the Janta curfew. This phase was introduced with restrictions that included all transportation services, which included road, air and rail, to be suspended, with exceptions for transportation for essential goods, fire, police and the emergency services. Educational institutions, industry establishments and hospitality services were also suspended. Essential services such as food shops, banks and ATMs were, however, exempted from the rule. In the beginning, widespread disruption of the essential supplies among states with sealed borders, cut-off corridors. There was much confusion among lower-level officials of the government, with disaster management laws invoked as to what constituted essential services in actuality. Grocery stores scrambled to keep supply intact and vendors faced severe logistical challenges which kept getting worse. In between all this chaos, there were several cases that were being reported of misconduct by security personnel in various states across the nation while the lockdown was being implemented. Severely harmful economic consequences of a prolonged lockdown had begun to unfold. Government officials and NGOs struggled to feed the urban poor, who themselves had no means of bringing in food to their tables and feeding their families. Several heads of the states requested the centre to reconsider an extension of the lockdown when people themselves were coming forward, requesting their state governments to enforce an extended partial shutdown at the least. The government, being very concerned about how a country 1.3 billion large would be able to deal with this pandemic if numbers continued to rise the way they were, extended the lockdown. Although it was what seemed like the right thing to do at that time, this step put the ordinary citizen in a tight spot. The agriculture sector, which was adversely affected, was exempted from the second phase, given that agriculture is what 2/3 of the population of this country depends on. Lower yield meant that lower income for farmers, and hence the poor demand for consumption, which would lead to multiple other problems. Diagnosing based on the symptoms, one did not need a degree in economics to predict what was coming. A global recession was on its way, and it is going to be worse than ever before. With half of the world's population locked down in their own homes with restrictions on movement, businesses and more or less everything, the pace of the global supply chain had turned sluggish. Towards the end of Lockdown 2.0, the Ministry of Home Affairs issued guidelines for state to allow interstate movement for stranded people, along with proper screening and quarantining of them, so that people away from their families can finally come back home. The third phase of this lockdown saw a partition unlike any other. The entire country was divided into 3 different zones: red, orange and green, each based on the number of Covid-19 positive cases reported there. Red zones were those with the highest number of coronavirus cases, with a high doubling rate. Orange zones had comparatively fewer cases, and green zones were those without any positive cases in a period of 21 days. Zones with warmer shades had stricter rules and regulations, with more restrictions imposed as compared to other zones. Public transportation amenities resumed towards the end of April, with offices opening up, some with 50% and others with 10% working capacity. This period saw banning of various delivery services by state government despite the central government's approval. Thousands headed home from major cities of the country as job cuts hit them hard. With a surge in sales of illicit liquor, many states turned on keeping open liquor shops, also levying heavy taxes on them. When lockdown began on the 24th of March 2020, the total number of confirmed cases stood at a little over 500, and there were only 10 deaths recorded across the country at that time. Towards the end of the 21-day lockdown on the 13th of April, the total number of cases crossed 10,000 with 358 deaths. From the 14th of April 2020, the pace at which the cases were multiplying started to increase at an unprecedented rate. The score stood at a little over 10,000 towards the beginning of the second phase, but touched the 40,000 mark in a period of 2 weeks. The rate of the recovery picked up in the first week of May, thanks to the implementation of an extended lockdown with patients getting cured 8 times faster. Lockdown 3.0 began with a little over 42,000 positive cases in the country and over 1,300 deaths. The numbers, however, started to sprint despite the further lockdown extension. The last week of this third phase of the lockdown saga, the numbers have almost approached 80,000, while the death rate barely doubled since the beginning of the lockdown 3.0. The number of patients cured and discharged of the novel coronavirus has multiplied twofold, signaling towards a lesser mortality rate and a much higher recovery rate than most developed nations. With India ranking 11th on the global list of countries worst affected by the virus, would further relaxations bring about a bigger jump in the positive cases in Lockdown 4.0? Despite acting quickly on the entire situation, the World Health Organization warns us of scattered outbreaks across the nation. Need of the hour is to strengthen our healthcare infrastructure. As the world gears up to face a rapidly approaching and inevitable spike in numbers, are we prepared to step into a world where COVID-19 is the new normal?